Every year in America, hundreds of thousands of people walk into a hospital believing one sentence without question: your doctor says you need surgery. And most never stop to ask the one thing that could completely change their lives: what if I don't? Because here's something the medical industry rarely says out loud. Some surgeries are absolutely life-saving, but others, they happen simply because surgery has become the default answer. Faster for the system, more profitable for hospitals. Easier than spending months trying conservative treatment first. In 2025, a shocking healthcare review revealed that more than 200,000 Americans may have undergone low-value back surgeries that experts now believe many patients never truly needed. The cost? Nearly $2 billion. But the financial damage is nothing compared to what happened to the patients themselves: scar tissue, chronic pain, nerve damage, reduced mobility. People who walked into the operating room with a manageable problem and walked out with a permanent one. And this is the terrifying part. Most of them trusted the recommendation completely. A man in his early 50s went to a clinic because a patient of mine had mild lower back pain after gardening. He expected physical therapy, maybe stretching exercises. Instead, within 3 appointments, he was scheduled for surgery. He was told it was routine. 6 months later, he still couldn't sit comfortably for more than 20 minutes. The pain that once came and went had become constant. Stories like this are becoming impossible to ignore. Even major medical organizations are now quietly rethinking how aggressively surgery is recommended, because doctors are beginning to realize something uncomfortable. When surgery becomes the first option instead of the last, the body often pays the price. The truth is, the human body remembers every incision, every puncture, every scar, even when the operation is labeled successful. And tonight I want to talk about 5 procedures I would personally avoid unless there was absolutely no other choice left. Not because I'm against medicine, not because surgery never helps people, but because too many patients are being rushed toward operating rooms before they fully understand what can happen after the procedure is over. And the first one may be the most disturbing of all. The first procedure I would think very carefully about before agreeing to is something called diagnostic laparoscopy. And the reason this one disturbs me so much is because many people are told it is minimally invasive, when in reality, it is still surgery. Your abdomen is still being punctured, your organs are still being manipulated, your tissues are still being injured. The word minimally invasive does not mean harmless. Here's what actually happens during the procedure. A surgeon creates small incisions through the abdominal wall and inserts metal tubes called trocars directly into the abdomen. Through those openings, a camera and surgical instruments are pushed inside the body. But the abdominal cavity is not an empty space waiting to be explored. Your intestines, stomach, liver, bladder, and blood vessels are packed tightly together. To make room for the camera, carbon dioxide gas is pumped into the abdomen, inflating the body from the inside like a balloon. Pressure rises sharply. The diaphragm gets pushed upward. Breathing becomes more difficult. Ligaments and connective tissues are stretched in ways they were never naturally designed to tolerate. And then comes the part most patients are never. The body heals every surgical injury with scar tissue. Always. Not sometimes. Always. Even tiny punctures create internal scarring beneath the skin. In some people, that scar tissue forms adhesions, fibrous bands that can cause organs to stick together. Recent surgical reviews are now warning that abdominal adhesions after laparoscopic procedures may increase the risk of chronic pain, bowel complications, and difficult future surgeries years later. Yet despite all these risks, many patients wake up from diagnostic laparoscopy only to hear one sentence: "We didn't find anything serious." Imagine going through anesthesia, abdominal inflation, tissue injury, and recovery, only to discover the surgery itself may become the source of future pain. I once heard about a woman who underwent diagnostic laparoscopy because of vague abdominal discomfort that occasionally appeared after meals. Her scans were mostly normal, but doctors wanted a closer look. The procedure found nothing dangerous. But within months, she began experiencing a new kind of pain she had never felt before: sharp pulling sensations whenever she bent forward, tightness near the surgical sites. Before the operation, she had mild symptoms. After it, she had daily ones. That story is becoming increasingly common. And here is what makes this even more concerning in 2026. Medical imaging has become extraordinarily advanced. High-resolution MRI scans, contrast CT imaging, ultrasound technology, and laboratory diagnostics are better than they have ever been in human history. In many situations, they can provide answers without ever cutting into the body at all. That does not mean diagnostic laparoscopy is never necessary. Sometimes it absolutely saves lives. But when surgery becomes the shortcut instead of the last resort, patients can end up paying for that shortcut with years of consequences. And the next procedure may be even more shocking, because this time, the patients are often children. The next surgery is one that terrifies parents the moment they hear the diagnosis: umbilical hernia repair. Because the second most dangerous sentence in medicine after "you need surgery" might be this: your child needs surgery immediately. The fear works instantly. Parents imagine organs rupturing, internal bleeding, permanent damage. And under that pressure, many agree to surgery before they even understand what an umbilical hernia actually is. In reality, an umbilical hernia is often nothing more than a small weakness in the abdominal wall near the belly button, where tissue or part of the intestine pushes outward slightly. In newborns and small children, this is incredibly common. And according to major surgical organizations, the overwhelming majority of small umbilical hernias close naturally as the child grows. Some studies estimate that up to 95% of hernias smaller than 1 centimeter seal on their own before the age of 5. That means nature fixes most of them without a scalpel. But many parents never hear that part first. Instead, they hear words like operation, complication, and risk. Fear enters the room. Rational thinking, and once surgery becomes emotionally linked to protecting your child, almost nobody feels comfortable questioning it. I remember hearing about one family whose 3-year-old son had a small hernia that caused no pain at all. The child played normally, slept normally, ate normally. But after one appointment, the parents left believing surgery. The situation was urgent. They scheduled the operation within weeks. The procedure itself went smoothly. Doctors called it a success. But afterward, the boy became terrified of hospitals. He cried during routine pediatric visits for years. The scar near his belly button hardened as he grew, and his mother later admitted something heartbreaking. "I don't know if we helped him," she said, "or if we just got scared." And that is the real issue here. Not that surgery is always wrong, but that fear often pushes families toward invasive treatment long before conservative options are fully explored. Now, to be absolutely clear, there are situations where hernia surgery is truly necessary. Large hernias can trap part of the intestine, cutting off blood supply. This is called incarceration, and it can become a genuine emergency. In those cases, surgery can save a child's life. But those severe cases are, for many children, doctors now recommend watchful waiting instead of immediate intervention. Monitoring growth, strengthening abdominal muscles naturally, giving the body time to mature and close the opening on its own. Because the human body is not weak, especially in children. It is constantly rebuilding, strengthening, adapting, and healing. And sometimes the most responsible medical decision is not acting faster. It is knowing when to step back and allow the body to do what it was biologically designed to do. But the next procedure on this list is even stranger, because millions of people never even think of it as surgery at all. They call it just a shot. Yet some doctors are now repeated injections may quietly damage muscle tissue for years without patients realizing it. The next procedure sounds so ordinary that most people never question it. Intramuscular injections, vitamin shots, antibiotic shots, hormone injections. Millions are given every single day. Nurses perform them in minutes. Patients barely think about them afterward. But here is the uncomfortable truth. Every injection is still a controlled injury to living tissue. A needle pierces through the skin, through fat, and deep into muscle fibers. Medication is then forced into tissue under pressure, physically separating muscle fibers apart to create space for the liquid. The body immediately responds the same way the body responds to every injury: inflammation, repair, and scar formation. One injection may leave almost no noticeable damage, but repeated injections over months or years are. Some doctors are now warning that chronic intramuscular injections can gradually transform healthy muscle into dense, fibrotic tissue, especially oil-based. Injections like certain vitamins and hormones, which remain trapped inside the muscle longer and trigger more prolonged inflammation. And most patients have absolutely no idea this is happening beneath the skin. I once heard a former hospital nurse describe patients who returned repeatedly for vitamin injection programs. Some had received so many shots over time that their gluteal muscles became unusually hard and resistant. She said inserting the needle no longer felt like going into normal muscle tissue. It felt like pushing through rubber. That image stayed with me because society has trained people to associate injections with stronger treatment, more serious treatment, more effective treatment. Patients sometimes request shots because they believe pills are weaker. But modern medicine increasingly shows that many oral medications are absorbed remarkably well. In countless situations, tablets might work just as effectively without repeatedly damaging muscle tissue. And then there are the complications most people never hear about until they happen to them personally. Recent medical reviews continue warning about sciatic nerve injuries caused by poorly placed injections. The sciatic nerve is the largest nerve in the body, running through the gluteal region down the leg. If the needle strikes or irritates it, patients can experience burning pain, numbness, weakness, or shooting electrical sensations that may last for weeks, sometimes longer. Other patients develop abscesses, painful pockets of infection buried deep inside the muscle. Some require surgical drainage. Others struggle with chronic inflammation at the injection site for months afterward. What makes this even more disturbing is how casually injections are often given. Quick appointment, quick shot. No discussion about alternatives. No conversation about long-term tissue damage from repeated use. Again, this does not mean injections are never necessary. In emergencies, they save lives. Certain medications truly require intramuscular delivery. And for patients who cannot absorb medications normally through the digestive system, injections may be essential. But the problem begins when convenience, habit, or outdated practice replaces medical necessity. Because the body keeps score of every injury, even small ones. Scar tissue does not disappear simply because the wound was caused by a tiny needle instead of a scalpel. And the next surgery on this list may be the most emotionally manipulative of them all. Because this time, people are not being sold relief from pain, they are being sold relief from aging itself. The next surgery may be the most psychologically powerful procedure on this entire list. Because unlike the others, it is not usually sold through fear, it is sold through hope. The hope of looking younger, fresher, more attractive, more relevant. I'm talking about facelift surgery. And right now, facelift procedures are exploding in popularity, especially among adults over 40. Some plastic surgeons are even reporting a major increase in patients after rapid weight loss from GLP-1 drugs like Ozempic and Wegovy. Social media has intensified it further. People spend hours staring at their own faces on screens, comparing themselves to
A facelift does not stop aging. It only rearranges.
tissue that is already aging. To perform the operation, surgeons create incisions around the ears, hairline, and scalp. Skin is lifted away from underlying tissue. Muscles and connective structures are tightened and repositioned. Excess tissue is removed. Then everything is pulled back into place. And once again, the body responds the same way it always does. Every scar changes blood flow. Scar tissue does not nourish skin the same way healthy tissue does. Some surgeons and researchers now, a strange paradox in cosmetic surgery is that procedures designed to fight aging may sometimes accelerate certain visible aspects of aging later by disrupting circulation, tissue integrity over time. Then there is the issue almost nobody talks about before surgery: facial harmony. Human faces are naturally asymmetrical. Tiny differences in muscle, facial features like tone, eye shape, cheek structure, and expression are part of what makes a face feel alive and recognizable. But surgery attempts to mechanically tighten and reposition tissue into preset ideals, which can't replicate natural, greater symmetry, and sometimes the result crosses an invisible line where the face no longer looks natural. You may have seen it yourself without realizing why it felt unsettling. A smile that looks slightly frozen, eyes that seem emotionally disconnected, skin pulled tight while the rest of the body continues aging normally. I once heard a woman describe the moment she regretted her facelift. She said the surgery technically worked. Her wrinkles were reduced. Friends told her she looked younger. But when she looked in the mirror, she felt something deeply disturbing. I still looked old, she said quietly. I just didn't look like myself anymore. That sentence says everything. Because people are not truly, they're afraid of aging. They are afraid of becoming invisible, especially online. Especially in a culture where appearance increasingly determines attention, opportunity, and even self-worth. And this pressure pushes many patients towards surgery before they've explored safer alternatives first. Better sleep, exercise, nutrition, stress reduction, improving circulation. Even simple facial muscle exercises and posture changes can dramatically affect how a face ages over time. Again, I'm not saying cosmetic surgery should never exist. Some people are genuinely happy with their results. But I believe every patient deserves complete honesty before making that decision. Because once tissue is cut, pulled, and scarred, there There is no true return to what existed before. And the final procedure on this list is perhaps the most controversial of all, because this surgery doesn't just affect one person. It may shape the future health of both a mother and her child at the exact same time. The final surgery on this list is the one people become the most emotional about, because now we are talking about childbirth, cesarean section. And before I say anything else, let me make one thing absolutely clear. In genuine medical emergencies, C-sections save lives. They save mothers. They save babies. Modern obstetrics would be unimaginable without them. But what concerns many doctors today is the growing normalization of elective C-sections. Cesarean section should only be performed without clear medical necessity. In some hospitals, surgical delivery has become so routine that many women begin viewing it as the easier option by default. No labor pain. A scheduled birth date. More control, more predictability. And for frightened mothers hearing horror stories online, surgery can begin to feel emotionally safer than natural birth itself. But the reality after the operation is often very different from what many expect. A C-section is major abdominal surgery. The abdomen is open layer by layer. The uterus is cut open. After the baby is delivered, multiple layers of tissue must be stitched back together again. A permanent scar remains on the uterus for life, and that scar can matter deeply. And doctors continue warning about increased risks of placenta accreta, where the placenta grows dangerously into the uterine scar, as well as uterine rupture during future pregnancies. Later labor, both can become life-threatening emergencies. Then comes recovery. Many mothers expecting an easier birth are shocked once the anesthesia wears off. Sitting up hurts. He cried during routine pediatric visits for years. The scar near his belly button hardened as he grew, and his mother later admitted something heartbreaking. "I don't know if we helped him," she said, "or if we just got scared." And that is the real issue here. Not that surgery is always wrong, but that fear often pushes families toward invasive treatment, long before conservative options are fully explored. Now, to be absolutely clear, there are situations where hernia surgery is truly necessary. Large hernias can trap part of the boy's condition was urgent. They scheduled the operation within weeks. The procedure itself went smoothly. Doctors called it a success. But afterward, the boy became terrified of hospitals. But the conversation inside medicine is becoming much more serious. There is also the physical transition into breathing. During vaginal birth, pressure through the birth canal helps clear fluid from the baby's lungs naturally. Babies born through C-section sometimes need additional respiratory support because this process happens differently. Again, none of this means C-sections are bad. In emergencies, they are miracles of modern medicine. But convenience alone should never become the reason for major surgery. Because childbirth is not simply about getting the baby out safely. It is one of the most biologically complex events in the entire human experience. And when surgery replaces that process unnecessarily, both mother and child may carry consequences that last far longer than a single day in the operating room. So what should you actually take away from everything you heard today? Not that surgery is evil, not that doctors are villains, and certainly not that every procedure is unnecessary. Modern medicine saves millions of lives every year. But the danger begins when people stop asking questions and start treating surgery as the automatic next step. Because once tissue is cut, the body is never exactly the same again. Scars form, nerves change, muscles adapt, adhesions develop. And sometimes the operation that promised relief becomes the beginning of an entirely new struggle. That is why one of the most important medical questions you can ever ask is incredibly simple. What happens if I wait? What happens in 3 months? 6 months?